So if you're dealing with low back pain or sciatica and you've recently had a MRI or an X-ray and it's been shown that you have either spinal stenosis, degenerative disc disease, arthritis, or a herniated disc, listen very closely. This may surprise you. Just because you had those symptoms does not necessarily mean that those are the cause, that's the reason for your pain. For example, there's a lot of people who, we work in a physical therapy clinic and we see a lot of patients with low back pain. A lot of patients will bring their X-ray, MRI reports to us and they'll say, hey, I know what the cause of my pain is. It's spinal stenosis or it's a herniated disc. Well, it may be that those findings, they truly do have a herniated disc or spinal stenosis, but that may not be the reason that they're actually having pain. There was a study that was recently done in the Journal of Spine, and what they did is they took over 3,000 healthy individuals. So these are patients, these are people that don't have any low back pain or any symptoms. They're doing great. And they did an X-ray or in this case an MRI on those individuals, and here are the results that they found. It's pretty interesting. So for normal individuals, by the age of 20, 30% of them had some signs of a disc bulge. So by the age of 20, very young, healthy, we don't usually associate these individuals with having that, 30% chance of having that. By the time that they were 80, so they looked at 80-year-olds, 84% of them had disc bulge. So, but once again, remember, these are people that do not have any symptoms. They're doing great. Then if you look at spinal stenosis, they looked at several patients that were 20 years old. 37% of them were showing signs of spinal stenosis or narrowing of their spine. But once again, they were symptom-free. By the time they looked at the 80-year-olds, 96% of them had signs of spinal stenosis, but they didn't have any pain from it. So how can that be? Well, oftentimes the cause of low back pain is not necessarily coming from a disc bulge or spinal stenosis. There could be another cause. And the best way to determine that, X-rays and MRIs are helpful because they give a really detailed look, but movement testing is one of the best ways to determine the true cause of your symptoms. So thanks for watching the video. If you like this, please subscribe below, and we'll be rolling out some more content for you guys real soon.